Another common question that I get asked is, what do I actually start with? You may have heard the phrase, food before 1 is just for fun. I don't actually agree with this. I think that introduction of complementary food around 6 months of age is a very important stage to introduce different textures, flavors, and many different exposures. However, we want to optimize nutrition as much as possible from breast milk and formula. For this reason, we recommend giving breast milk or formula first, and then 30 to 60 minutes later, if your child is showing interest in food, that's when you can start giving the food. If you were to take a jar of store-bought baby food and look at the calories per ounce, you'll notice that it is a lot less than it is from a 4-ounce bottle of breast milk or formula. With less calories per ounce, your child may require more volume in order to feel full. However, they're not getting as many calories in, and so for this reason, we recommend doing breast milk and formula first and then giving your baby the food. So the actual order of giving food doesn't really matter. You can give food in whatever order you want. You can do veggie first, or you can do meats first. They do have preferences and they do develop this early, but the key here is to rotate the food so that your child is getting exposed to many different types of foods. Your infant's iron stores in the body do start to deplete around 4 to 6 months of age. For this reason, we recommend that you focus on iron-rich foods. So we used to recommend giving one new food every 3 to 5 days. That way, if your child has a reaction, you're able to better pinpoint what they're reacting to. This information is now controversial. However, we don't have any new official guidance from the Society of Allergy and Immunology, so I still recommend giving one new food every 3 to 5 days, and once they've tried a variety of different foods, you can start to combine and mix their food up. Don't be afraid to play around with different spices for your child. This is going to add many different flavors, and this will be important as they expand their palate. The only recommendation is to limit the amount of salt that you're giving, as their kidneys are still maturing and we don't want to overload with extra salt. You're going to want to feed your baby such that you're following their cues. So if your baby is showing that they are full, they may be turning their head back and forth, they may be pursing their lips, or they may be batting the spoon out of your hand. This most likely means that they are full and they don't want any more food. You don't have to start your child on cereals. But if you do, we recommend trying oatmeal instead of rice, as the rice cereals have been shown to have a lot of arsenic. The goal is to have your child eating the same type of food that you're eating within reason by around 9 months of age. Some children do get there a lot sooner than others, and some take a little bit longer. That's okay. You're going to want to increase the texture of the foods as tolerated by your child. You don't need to wait for teeth in order to do soft, mashable finger foods. Their gums are very strong and they will be able to mash the foods as needed. If you do the increased texture and you notice that your child is having a particularly hard time with swallowing, you can always go back to the softer purees and then try again in a couple of days. Just a reminder, when your child gets to the soft finger food stage, you're going to want to make sure that you're preparing appropriately so that it does not pose as a choking hazard. When can I introduce utensils? You can actually start as early as 6 months old. Most children will get the hang of it around closer to 9 to 12. There are several different methods that you can do. You can actually preload the spoon or the fork with food and place it on the tray and have your child bring the utensil to their mouth. You can preload it and then put it in your child's hand, or you can just give the spoon or the fork and have your child try to do it with modeling from when you're eating.